you can hear everything appropriately. Very good. So no abnormalities noted so far. Normal sinus rhythm and rate is well within normal limits. I'm going to shine my light, bring it in to the corner of her eye. You should be able to visualize the tympanic membrane, notating any abnormal signs of cerumen, which is not notated here. Very good. Go ahead and close. And then we are going to percuss along the mandibular joint. So just gently touching the corner of your eye there. Very good. Sharp riddle. Good. Very good. Sharp riddle. All right, Sandra. Beginning with your examination today, I would like to go ahead and get you fitted for your Manta sleep masks of choice. Now, prior to your examination, we did go ahead and obtain your custom measurements in order to ensure that your mask would be custom fitted to your exact specifications. So you have stated that you have some trouble sleeping as well as issues with sensitive skin, so you were slightly concerned that a mask would irritate your skin. Now, for that reason specifically, I have chosen the Manta silk mask. As commonly known, silk is a non-comedogenic fabric, so it's very gentle on the skin. This mask in particular is made with cushioned eye cups that allow for a comfortable night's sleep with plenty of space for your eyelids as to not put excess pressure along your eyes, as I know that was also a concern for you. So I have adjusted this mask to your specific measurements, and I am going to go ahead and place it on you now. So I'm just going to make some small adjustments here, ensuring we have an appropriate fit for you today. So as we can see, there is a curvature at the bridge of the nose, and the texture is very soft and supple enough to not irritate the skin. So this is one that I would definitely recommend for daily use. It is also very easy on the hair, as you've stated you have some concerns about your hair texture being altered and rubbing against the mask. So the silk mask is another great option for both of those concerns. Now, I'm going to go ahead and remove this one and recommend a secondary mask. Now this is one that I quite like for travel, as it is very lightweight, easily foldable, easy to manipulate. Once again, this mask has been measured to your custom specifications. The only difference here being these C-shaped eye cups, which are tapered at the sides to accommodate your preference for side sleeping. So I am also a side sleeper, and I find that the C-shaped cups allow for a very comfortable night's sleep without putting extra pressure on the temporal region of your head. So bringing this down along the bridge of the nose. Once again, going to adjust the mask in the back to your measurements. And just make a few minor adjustments here to ensure we are getting a proper fit. Now, another great feature of this mask in particular is the mesh fabric. So the mesh fabric of the Pro mask allows for breathability and proper air circulation, which will also help with some of your skin concerns. So shouldn't produce too much heat around the eyes, and those tapered cups will allow for a very comfortable night's sleep, whichever position you choose. Just making sure we have the proper fit here at the back. And once again, this mask does have that blackout feature, so there should be no light protruding through, thus ensuring a wonderful night's sleep. I also appreciate that there is a silicone strip at the back of the mask so that it does not slip. It gives it a little bit of stick to the hair, which I find quite nice, as I tend to move around frequently in my sleep. Sandra, if you or any of my viewers would like to purchase any of the products seen today, as well as anything else on the Manta Sleep website, I would highly recommend checking out the description box as well as the pinned comment, where you will find code SIESTA that can be used towards 10% off your purchase at Manta Sleep. Okay, so once again, as we proceed with your examination, I would like to thank Manta Sleep for sponsoring today's video. We are very happy to continue our relationship with them. Let's go ahead and proceed into your demonstrative cranial nerve exam. All right, everyone, welcome to class. Please take out your notebooks and your pencils as we get started with today's demonstration. I'll give you a minute. Is everyone ready? Okay. Well, as always, we'd like to thank Sandra for joining us as our volunteer patient for the purposes of today's demonstration. I will be performing a cranial nerve exam and cognitive assessment today. Okay? So this is a simulation, of course. I will be treating this as I would with real clinical practice, and I'd like you to notate accordingly. All right. Okay. So, as with every assessment, you begin by obtaining your patient's identity verification. So you would ask for first and last name as well as date of birth. Okay? So Sandra, if I can just have you confirm your first and last name for me as well as your date of birth. Thank you very much. I have you all checked into our system. Okay. So let me just pull up your chart here. So it looks like Sandra is here today for a follow-up visit post brain surgery she had a few years ago. So today we will be performing a reassessment or her annual test to make sure that everything is still functioning correctly neurologically, or if there are any new deficits that were not notated upon her last visit. Okay. Now, as with all of our examinations, for demonstration purposes, Sandra will not be responding verbally, but I will be acting as if she is responding to me. Okay. All right. So we are going to go ahead and get started with our demonstration today. Of course, at this point, I would wash and dry my hands thoroughly. My hands have been cleaned prior to the session. I just want you guys to notate accordingly. Always clean your hands prior to touching your patient or any of your tools. Okay? All right, so I'm just gonna come a little bit closer to our patient here and begin by just performing a basic visual inspection. So I'm just gonna look at her face. Sandra, I'm just gonna turn your face here slightly. So just having a look at the overall posture as well as bone structure, skeletal structure of the face. Because this is a neurological examination, we definitely want to look for any signs of stroke, Bell's palsy, anything that could indicate an abnormality in the nerve endings of the face, any facial drooping, okay? So just looking at the eyebrows, alignment with the eyes as well as the mouth, and all of that looks equal. As well as looking at the shoulder alignment in comparison with the arms. Sandra's posture is good. She's sitting upright. There's no slouching. Okay. So all of that looks okay. I'm going to follow that up with a secondary examination here. So I just have my pen light. And I always like to perform the initial examination without the pen light and then go in with my pen light as a secondary just to have a bit of a closer look. So I'm going to go in and shine my light over Sandra's face. At this point, I'm looking for any obvious abnormalities of the skin, any signs of lesion, broken skin, any dermatitis, psoriasis, eczema, anything that can indicate an abnormality in the dermis. So far, not notable. Just having a look at this point if she had any artificial enhancements such as facial piercings or tattoos. That's something that we would look over. Now in her case, I do see that she's had her eyes microbladed, her eyebrows rather, so that is something that I will have a look at, just notate any abnormality in healing there or any abnormal scarring, which is not noted. And it does appear as if she has an ear piercing, so all of that looks okay. At this point, it's also good to have a look at the ears. Just have a peek at the ear canal externally and look for any abnormal signs of cerumen that could be protruding outward. Okay, so I'm going to follow that down the neck. Not seeing any abnormality in alignment there. And having a look at the clavicle and chest wall. Looking for any discoloration of the skin, which is not notable here. And down at the legs, she has her feet flat on the floor, and I'm not noting any abnormalities there. Okay. All right. So I am going to go ahead and update my notes. So upon visual inspection, no abnormalities noted. Posture is intact and upright. I will note the microblading of her eyebrows as well as the ear piercings. Although she doesn't have earrings in, I can see the holes. So just making a note of that. Okay. So moving on to the second phase of our demonstration, can anyone tell me what we would be doing next? Yes, correct. Can you say that a little louder? Absolutely. So at this point in our demonstration, if this were a real clinical experience, we would be moving on to phase 2. Now, the vital signs have already been obtained by the nurse. So what we are going to do now is perform our stethoscope assessment. Okay? So I have my stethoscope here. I am going to be placing it on, and I will be performing a heart and lung assessment. Okay? So I'm just going to on my stethoscope. Always test to make sure you can hear everything appropriately. Now starting with the flat side, I am going to go ahead and auscultate. Okay, so Sandra, I will be coming just a little bit closer to you here, and you're going to feel a cold metal on your chest. Okay. Very good. So no abnormalities noted so far. Normal sinus rhythm and rate is well within normal limits. Not noting any signs of tachycardia or bradycardia at this time. So I'm going to move on to a brief lung assessment. Sandra, if I can have you take a deep breath in for me. Very good. One more time. Now at this time I would generally percuss, so we would listen, tap, and ask our patient to verbalize 99 several times as we listen to the lungs. Okay? Okay, so I'm just going to take your hand here, Sandra. We're going to count her pulse. Now remember, we are counting a full 60 seconds. It is not appropriate to count to 15 and then multiply by 4, as heart rate can vary second by second. So you do need to be counting for a full 60 seconds to get an accurate reading of pulse. Okay? All right. Thank you very much. Just going to update my notes there. Please remember also, if the nurse did not obtain vital signs and you are obtaining them yourself, you do need to make sure that your patient's feet are uncrossed and they're lying flat on the floor. Okay? Okay. All right. So we're going to go ahead and move right along, class. Please make sure you are keeping up with your notes, as I will run through this rather quickly. We have quite a bit to go over today. Okay? All right. So Sandra, we are going to go ahead and move on. Now, I am going to proceed with our visual examination. So we are going to move on to our eye test as well as our ocular motor test. Okay? So I am going to start off with my pen light. Sandra, if I can just have you open your eyes for me. So I'm just going to be checking for pupillary reaction, constriction, and dilation. Okay? So starting here, I'm going to shine my light, bring it in to the corner of her eye. Check for consecutive response, which is present. Secondary test to make sure. And then we test the eyes individually. Very good. Sandra, I'm going to have you look at my finger. Now look at the light. And look at my finger. And now look at the light. And now look at the light and at my finger. Very good. Okay, so her pupillary reaction is well within normal limits. I'm going to follow that up with a test with my ophthalmoscope. So just going to begin by attaching the correct head here. Sometimes it gives me a little bit of trouble. There we go. Okay. So you always want to make sure that the light is present before you bring it closer to your patient's eye. And we are starting off at a level 10, which is standard visualization. Okay? All right. So I am going to come much closer to your face here, Sandra, and I'd like you to just turn your head towards me slightly. And very gently pull down at the lower eyelid, and we are going to visualize the optic disc following down along the optic nerve. Good. Of course, testing bilaterally. And very good. Okay. So what I would like to do now is have you follow the light for me just briefly, Sandra. So I'm going to hold this up here, and I'd like you to just follow that light with your eyes only. Don't move your head. Good. And in and out. Very good. Okay. And that would complete the ophthalmoscope visualization. Okay. All right. So we are going to go ahead and complete our eye exam. So moving forward, I'm going to demonstrate a test for color deficiency. Now, as stated, Sandra is not going to respond verbally, but I will be demonstrating for you guys. Just use your imagination of how our patients would respond appropriately. Okay, so this is our Ishihara test plate. You guys should all have paper copies of this. Okay. I like to start off with the first test plate, which is just the control, to make sure that our patient is in fact seeing both colors. If they fail the test plate, then we would need to move on to a secondary test. Okay? So Sandra, this is the point where I would have you look at the test plate and you would verbalize to me whether you do or do not see a number 12. Okay? Moving on to our green, I would like you to tell me if you see a number here as well as here. And here, as well as here. So the correct response would be that we see a number 2. A number should not be seen here, okay? If your patient does verbalize that they see a number on this test plate, you would need to continue testing to determine whether or not it was a mistake or they truly are having issues with their orange color theory, okay? So this is a follow-up for that. So we should be seeing a number here. And here we should see a pattern, but not a number. So you often have patients say, I don't see a number, I see a snake, or I see a green line. So you would ask your patient to use their index finger to trace the line from start to finish. So Sandra, if I could have you trace the line for me, and she would trace it appropriately, okay? Lastly, our grayscale, same thing, not a number. You would have them trace it for you. For the second one, I like to ask them to use the opposite hand, and that just allows you to test for dexterity. Okay. All right. So moving on to our Snellen chart. Now, as with any Snellen chart, you want to use the appropriate scale versus feet. So if you're using a standing chart, then the patient would be 20 feet away from the chart. This is a pocket chart, so it's about an arm's length away, which would be an appropriate distance. Okay, so I am going to hold this about an arm's length away from Sandra's face. This would be the time that I would ask her to read from top to bottom. So I do like to start with the largest number, have them read down as far as they can. If they can only read, for example, 2040, I would then ask them to attempt the 2020. If they cannot read at 2020, we then move up until we get to the standard line that they can read, at which point we would test the eyes individually. So to give you a demonstration of that, I would ask Sandra to then read the smallest line she can, occluding one eye, and then occluding the opposite eye. That way we can gauge whether or not the eyes are seeing different visualization. Okay? So we are now testing for Sandra's blind spot. Okay? So I like to use test tubes of varying colors. So I have a gray and an orange. Now you would ask your patient, Sandra, can you tell me what color this is? And what color this is? Very good. So I would like you to keep your eyes on the orange. Try not to look at the gray just yet, okay? So then you would begin by bringing the gray in and out of her visual fields. And at this point, we're looking for signs of nystagmus. So we're looking to see whether or not Sandra can see the gray through her peripheral vision, or if she's trying to track it, which would indicate a deficiency there, okay? So then we would switch, and I would ask Sandra to locate either color. So at this point, I'd like you to look at the orange and track the orange for me. Very good. Now I'd like you to keep your eyes here at the gray and tell me when the orange becomes visible to you. So at this point, the patient should verbalize that they are seeing the orange when it comes into their visual field, and you would test this equally to you. So to give you an example, I would be front facing to Sandra, and I would have her cover an eye. I would cover the same eye, and ideally we should be able to see it in our visual fields at the same time. Okay? Very good. So just going to catch up on my patient documentation. Her ocular examination was well within normal limits. So for the purpose of the demonstration, we will say that Sandra's Snellen chart examination was a result of 2040. And she does wear corrective lenses. Ophthalmoscope examination was also well within normal limits. There were no issues notated with the optic disc and no signs of color blindness or color deficiency. Okay, moving right along. Does anyone have any questions pertaining to the eye exam portion? Okay. All right, so we are going to move forward, and I am going to go ahead and proceed with our ear, nose, and throat examination. So this will be a brief overview of the ENT demonstration. Okay? All right. Okay, so let's go ahead and start with our ear examination. So I am going to place my otoscope. Again, always ensure that the light is visible prior to bringing it to the patient. Okay? And for this examination, I will stand so that I have appropriate visualization. Very gently placing the tip of the otoscope in your patient's ear, you are going to come forward, pull up and back at the ear canal. You should be able to visualize the tympanic membrane, notating any abnormal signs of cerumen, which is not notated here. Very good. Coming around to the opposite side. Same thing, up and back, and tympanic membrane is notated in a pearly gray. No signs of abnormal cerumen. However, I will say that the right side had just a little more than the left, which is totally normal. Yes, that's a good question. So if you notice that your patient has a significant amount of impacted earwax, that it is abnormally discolored, that it looks rather old or particularly waxy, then you can discuss the use of Q-tips with them, ask them about their hygiene practices, and kind of go from there. Get a better gauge at why it looks abnormal, and if need be, you can follow them up with an otolaryngologist. Okay? All right. So moving right along, in line with our ear examination, this is the point where we would test our patient's hearing. Okay? So I like to do this a couple different ways. First way being just an audible examination. So I am going to perform a whisper test where I will be whispering a series of numbers and words into Sandra's ear, where she would then repeat them to me verbally. Okay? So Sandra, I'm going to occlude one side, and I'd like you to repeat after me after you hear a series of 3. Okay? Your patient would respond appropriately. Bird, glasses, chair. And again, your patient would respond appropriately. Now, I like to test that twice, once with word and once with numbers. So for the secondary test, it would look something like 57, 85, 365. You like to vary slightly. Okay? All right. So moving on to our nose examination. Again, using our otoscope. When switching from ears to nose, obviously switch to a fresh tip. Okay, so do not use the same tip that you used for their ears that you then use for their nose. All right. So coming in for the nasal examination, Sandra, I'm going to ask you to tilt your head back slightly for me. I am going to tilt at the bridge of the nose and have a look. Not noting any signs of occlusion, no abnormal mucus, and septum is aligned appropriately. Okay. So if you notice that your patient has a deviated septum or that it's inflamed or you see abnormal colored mucus, then that's something you would address further. Okay. All right. All right, so moving right along, we are going to test the oral portion of our demonstration. Okay, so I'm going to go ahead and ask Sandra to turn towards me just slightly. Sandra, if I can have you open for me. Very good. You would ask your patient to say ah, stick out their tongue, and you would visualize the uvula. Okay, so having a brief look at teeth and gums, oral health appears intact. Sandra, you can go ahead and close. Also looking at moisture levels of the lips, looking for any signs of abnormal dehydration there. Okay, all right. So that is where you would look for things like discoloring of the tongue, any signs of thrush, any irritation at the gum line, looking for signs of gingivitis. Ask your patient about their oral hygiene, how frequently they brush their teeth, how frequently they floss. Okay? All right. Sandra, I have a couple things that we are going to test here. So, testing Sandra's sense of smell, you would have 2 different objects, 2 to 3 that you would like them to indicate whether or not they can smell. So for the purposes of today's demonstration, I'll just be using test tubes. In clinical practice, you might use something like a cotton swab. So just to give you an example, Sandra, I'd like you to inhale for me and tell me if you smell anything, and if so, what you smell. Then you would wave the alcohol underneath their nose, and an appropriate response would be that they smell rubbing alcohol. Okay. If you were testing something else, you could ask them what they smell. For example, coffee is used frequently, coffee beans, cinnamon, lemon, anything that is a very common smell. You don't want to use anything obscure that you don't think your patient comes in contact with on a daily basis, or at least semi-frequently. Okay? Okay. So, at this point, we would be performing a taste test. I will have Sandra go ahead and taste it, and then I will verbalize for her the appropriate response. So we have a taste test here. Sandra, if I can have you take this from me. Just go ahead and give that a small taste for me. Very good. And if I were to ask Sandra what this was, she would tell me that it was citrus or lime-flavored Gatorade. Okay? You can test whatever you have in office. Some offices have you use normal saline or salt water solution or a sugar water solution or a variation of both. I usually test one. If you get a negative response there, then you can follow up to make sure that it wasn't an anomaly. Okay? All right. So we are going to pause for notes. So for Sandra's ENT examination, there were no abnormalities noted. Hearing appears to be intact. Her nasal examination was well within normal limits. Test of her olfactory nerve was normal. Taste test was normal as well. No abnormalities noted in oral health. And I will just make a slight notation that I noticed a very mild amount of excess earwax in the right ear versus the left. Okay. Very good. So we are moving right along. At this point, we are going to move away from the ENT portion and move into our secondary portion of the examination. So I am going to go ahead and place a pair of gloves on because I will be palpating her face, specifically around her eyes and her jawline. So in order to protect both myself and the patient, I will be wearing gloves. Typically during a regular clinical experience, I would wash my hands. Okay? Okay. So Sandra, at this time I am going to touch your face. I will be palpating around or manipulating you with my hands. Please do let me know if any of this causes you any discomfort, okay? So we are going to start at the brow, palpating along the brow line, Feeling for any abnormal signs of distension, any swelling or edema, any excess pockets of fluid, signs of tenderness, filling along the orbital socket very gently, down along the nasal passages, feeling for any abnormal signs of occlusion here, any issues with nasal patency. Of course, you would test this bilaterally. Feeling down along the nasal passages, following that down the mandible, feeling along the gum line. Good, and now we are going to follow down the chain of nodes. Down along the thyroid, feeling for any signs of swelling or abnormal placement here. Checking for mobility. You should feel a slight shift. And of course, feeling along the clavicular line of nodes here as well. Okay, so no signs of swelling or abnormal distension of the nodes. During a cranial nerve exam, it's not something you would test extensively. If you were more in gynecological practice, then you would continue to test the chain of nodes down into the axilla. Okay? All right. So moving forward, we are going to test reflexes. So let's go in with our reflex hammer. I have a variety that we will be testing today. I'm going to start with a test for jaw reflexes as well as testing for TMJ. Okay? So Sandra, I'm going to have you hang your jaw loosely. Very good. Very good. Go ahead and close. And then we are going to percuss along the mandibular joint. Good. No signs of abnormality there. I'm also going to percuss at the clavicle. Now we can go ahead and test for upper extremity reflexes as well. Okay? So Sandra, I am going to take your hand. I'd like you to just rest the weight of your arm in my hand. I'm going to begin by testing at the elbow. Good. We'll have her place her hand on her lap. Test at the wrist. Good. And lastly, at the second finger. And of course, we would perform that test bilaterally, as well as our lower extremity reflexes, where we would test at the knee, as well as testing for Babinski reflex, and you can use the other side of your hammer for that. Okay? So I would just like to have you guys note that if any of the reflexes were to come about with an abnormal reaction, specifically the Babinski, then we would like to follow up there. So we would retest. You can test with a secondary object, something a little more prominent. So we can retest with something like a Wartenberg wheel, which offers a more distinct feel and should elicit an appropriate reaction. Okay, all right. So we are going to move on to testing our direct neurological response. So at this point, we are going to test for tactile sensation. Okay, so a couple different things we will be using for that. Going to start with the simplest and just a normal cotton swab here. Now, while I have this out before I use it on her face, I am going to go ahead and test her ocular reflexes. So Sandra, if I can have you open your eyes for me. I'm just going to bring this object to the corner of your eye, and this is testing the reflexes of your eye itself, so you should feel yourself blink, okay? So just gently touching the corner of your eye there. Very good. I like to test twice. Very good. So very normal reaction there. Anytime an object is coming towards your face, the natural reaction should be to blink in order to protect your eye. Okay. So So now we are going to begin with our test for soft sensation. So Sandra, I'd like you to close your eyes for me. I'm going to touch your face with a very soft object. I'd like you to start by telling me if and when you feel something, okay? So obviously Sandra is not going to respond, but I will still demonstrate it appropriately. So we are going to vary our test for the first round. I like to vary between a swiping motion or just a soft pat. You don't want to move in a linear pattern or a pattern in which it would be easy for your patient to memorize and therefore give you an inaccurate reading. So Sandra, can you just tell me if this feels about the same as this? And this should feel the same as this. This should feel about the same as this, as well as this and this. If your patient were to verbalize that there were any differences between the two sides, then you would follow up and retest with a different soft object. Okay? Now we are going to assume that our patient responded appropriately, so we are going to move on to testing for sharp versus dull sensation. So testing for a varied response. Okay? So Sandra, at this time I'd like you to indicate to me whether or not you feel sharp or dull. Okay? So sharp or dull? Good. Sharp or dull? Sharp or dull? Sharp or dull? Sharp or dull? Good. Sharp or dull? Sharp or dull? Sharp or dull? Good. Very good. Sharp or dull? And sharp or dull. Good. Okay. So assuming all of those responses were appropriate, I would then test for sharp and cold response. So just to give you a brief demonstration, we would show our patient that this is a very sharp sensation. Not to be alarmed, as it will not break the skin. I do always like to give that disclaimer, as this can look a little dangerous, so do just tell your patient that they shouldn't be alarmed, but they will feel the very sharp sensation. And we would again test that bilaterally, asking if the patient feels a sharp sensation. And we can say, does this feel the same as this? Does this feel the same as this? Testing for cold response would look something like bearing in mind that metal is a heat conductive object, so after a few touches it is not going to feel as cold, in which case you can switch to a different tool. Okay? All right. Okay. All right, Sandra, so that is going to conclude the cranial nerve portion of the examination, and we will now be moving on to the cognitive examination. Okay? All right. All right, Sandra, so we are going to go ahead and proceed with a very brief cognitive assessment as to demonstrate to our patients how this would work in a clinical practice. Okay, so I'm going to ask you a few questions, and I'd like you just to respond appropriately. All right. So if I could have you repeat after me. The cat crawls into the barn at night.
The cat crawls into the barn at night.
Very good. Red leather, yellow leather.
Red leather, yellow leather.
Very good. Now I'm going to give you a series of numbers. I'd like you to attempt to add them together just mentally, okay? So if I can have you add 1 plus 4 plus 5. Very good. Can you tell me who the current president is?
Donald Trump.
Very good. Can you tell me what day it is today?
It is Saturday.
Today is Saturday. Very good. All right. Now, lastly, I'm going to hand you my keyboard. I would like you to spell out your first name. Very good. Okay. So that will complete the basic cognitive assessment. So in actual clinical practice, you would test that more thoroughly. We would do a stroke evaluation as well as test for some other things, a more extensive test for color deficiency, motor functioning skills. Just to give you an example, I would test for things like graphesthesia. I would also test whether or not Sandra can pinpoint certain things. So Sandra, if I can take your hand, if I were to ask you to close your eyes for me and draw a number in your hand, I'd like you to attempt to tell me what number I draw in your hand. So go ahead and close your eyes for me. So she would indicate either a number 6 or a number 9. Both would be considered a correct response. I also would test for a number 8 and then maybe for a number 5. And then on the other hand, I would test a letter, always capital, so you can test for capital A, capital B, capital Z, just to give you an example. Okay? All right. All right, class. I would like you all to catch up on your notes. I want you to turn them into me at the end of class. So you have about 20 minutes, 25 minutes left. Catch up on your notes. You can do this collaboratively. I will be collecting your notes at the end of class to make sure that everything was documented accordingly. Okay? Once again, we'd like to thank Sandra for her time. And I hope you guys were paying attention because there will be a quiz as always.